Hello, my name is Mike Guzjelski. I'm a third-year pharmacy student at Wayne State University. Today I'm going to be going over the injections portion of your lab. First, we're going to properly wash our hands, which I've demonstrated in several videos before this, and then we are going to use gloves. Today I'm going to first introduce you to the equipment that will be used within this lab and the things that you might possibly see during your practicals. So we have our alcohol prep pads, sterile water for injection, insulin syringe with safety cap, 1 milliliter, 3 milliliter with luer lock, 5 milliliter with luer lock, 10 milliliter with luer lock, and 20 milliliter with luer lock. For needles, we have an 18 gauge 1.5 inch, which is pink. We have a 21 gauge 1.5 inch, which is green. 25 gauge 5/8 needle, which is blue. Now I'm going to go through the process of each of the different injections. Today we're going to use a 10 milliliter 18 gauge needle. Normally you would refer to this chart for the proper needle selection, gauge, and size. So we're going to first take our 10 milliliter syringe out of the package. Then we're going to take our 18 gauge needle, which is pink, 1.5 inch. Now you never want to handle the needle, so you want to keep the needle with the cap. Take the syringe, connect it to the needle, then pull out of the packaging. And discard in our sharps container. Now, you're going to want to remove the cap from the vial that you'll be injecting from. Take an alcohol prep pad. Clean the top of the vial, which you will be drawing your injection with your syringe. Remove the cap. So first we're going to draw the amount of air into the syringe that we need. We're going to use 5 milliliters. We're going to take the 18 gauge needle. Again, refer to the correct needle size and length for your specific injection. We're going to take with the bevel up, poke the point into the bullseye, and then rotate. We're going to inject the air into the vial. And we're going to withdraw the 5 milliliters into the syringe. A little more. So then we're going to force the air out exactly to 5 milliliters. Withdraw the needle. And we're going to inject our sponge. We're going to be demonstrating an intramuscular injection. For this, you want to go in at a 90-degree angle. Aspirate. If you notice any blood that comes into the syringe, you're going to want to discard the syringe and repeat the process because you're in a blood vessel and not in the muscular tissue. Then we're going to slowly inject into the patient and withdraw the needle and discard appropriately. Okay, again, we will withdraw the air into our syringe that we need for our injection. We're going to take the point again with the bevel up, target the bullseye, put the point in. This is to prevent coring. I'm going to rotate go into the vial. We're going to inject the air into the vial. Withdraw the correct amount, plus a little more, to make sure we have no air. Tap the needle, go back up to 5 milliliters. Withdraw from the vial. Now this is going to be a subcutaneous injection. So we would pinch the skin, go in at a 45-degree angle, aspirate. If you notice any blood, again discard the syringe. Then we would inject into the patient. Withdraw the needle and discard. Now that we've completed all of our injections, you want to note that some injections might not require aspiration. These will be gone over in your lecture portion of your lab. This now completes the injection portion.